It's another episode of Social Distancing at the Chamber, something we also sometimes call Happy Hour with Hammer. My name is Garrick Taylor, as always joined by the CEO of the Chamber, Glenn Hammer. Glenn, the stars across the state, they want to be on the show. They're demanding it. And we, again, have been able to accommodate another big-time star. Why don't you introduce our guest?
Well, we have one of Arizona's most thoughtful public officials, Maricopa County Supervisor Bill Gates. Yes, this is the Bill Gates that actually had what it took, has what it takes to have a Harvard degree. He made it through Harvard. Bill Gates. But the other one's still doing okay. He's still doing okay,
I guess.
But we've enjoyed over the years just working together on all sorts of different policy things. And I just want to say, from your stop at the City Council and now County Board of Supervisors, you've always been someone that has been able to balance out a lot of different things extremely well. And you're a big reason why where all the participants in this call are sitting is still the fastest growing county in the United States of America. Bill Gates, welcome to the show.
Well, thank you, Glenn. You're very kind. It really has been my honor to work with you on so many issues and challenges over the years. And thank you for your leadership, both in the private sector, but really across Maricopa County. And you're another one of the big reasons that Maricopa County also continues to be one of the fastest growing county in these United States.
Very nice to say. We're all working through the toughest healthcare challenge this country has faced in over 100 years, COVID-19. Can you maybe just give a little bit of an overview of the county's response to this global pandemic?
Sure. Everyone at the county, like really everyone in government, has been laser focused on the COVID-19 issue. And that is for the number one reason is that Maricopa County is the public health authority for the region. And so when that very first case of COVID-19 came in on January 26th, our folks at Maricopa Public Health were all over it. I happened to be the Board of Supervisors representative on the Board of Health. So we actually had a Board of Health meeting that next day, January 27th. And we were already knee deep in it. None of us could have imagined what it would become, but we as a team are on a daily basis on top of this, working with our county manager. Our board chairman, Clint Hickman, has been doing a great job of leading the board through all of this. But we're looking at one of the main things we're doing is getting data out to everyone, right? Everyone, I know this is the right audience for that.
Yeah.
But getting that information out there, letting people know what's going on. And I've certainly tried to do that through my social media. I know a lot of other people have done that. Another focus for us has been on the homeless and in general, those who are most vulnerable in our community. And so we've worked with our partners down at the CAS shelter in the downtown campus, trying to get people separated from one another, put that social distancing into place, particularly for those who are most vulnerable, and then also trying to support and giving the testing and the other resources to the long-term care facilities in our county.
Talking about long-term care facilities, and this is a trend we've seen in the country and in the world. I believe the latest statistics that the county publishes is of the 228 deaths, 158 have been associated with long-term health facilities. And I know that that's a big issue in Maricopa County and around the country. I would just love your thoughts on that situation.
Yeah, it's one of the tragic pieces of the COVID-19 tale is that it is attacking, our seniors, those who have given so much, those who should be, spending the golden years in a very positive way. They're having to face this head on, and we recognize that at Maricopa County and Public Health, and we've been working very closely with those long-term care centers, like I said, to get them the testing. Now everyone in those long-term care centers are getting the testing. We certainly want to recognize Governor Ducey and the Arizona Department of Health Services for their focus, the testing blitz that's coming out. And that's
Yes.
going to help all of us, but particularly as it relates to these long-term care centers, it's something that we are very focused on. Continue to do that. And again, it is truly a tragedy that we're seeing such high numbers, but that's why it's getting so much of our focus.
The testing is going up, and I wanted to ask you about the contact tracing program, which I'm very excited about what the county is doing. But in terms of the testing and the long-term care facilities, has that been ramped up, and does that include the workers and people who are coming in and out of the facility, and how to be thinking about diagnostic versus antibody tests that are now out there?
Yes, so at this point, the focus is on the diagnostic tests. That is something that we're making available to folks. We're also, when we're getting any PPE in at this point, we're directing that there. We want to make sure that those folks who are working, again, those are some more of our heroes here that are working in those care facilities so that they have the PPE that they need. As far as the antibody tests are concerned, that's not our major focus at this time. I think that's something, as those get perfected, that's going to be an important piece of the puzzle. Definitely tip my cap to the University of Arizona and ASU for the work that they've done. But at this point, really focusing more on the diagnostic tests. Again, I know what I don't know, and so I talk to the medical professionals or public health professionals every day, and that's where they're having us focus our attention.
Okay. Garrick?
Yeah. Supervisor, one of the things that people might not know is that the county also has a health role to play in inspecting restaurants. And when we were in the virtual green room here, you were explaining that restaurant inspection process goes on even when we are in curbside and pickup mode. And then could you talk a little bit about as we're getting ready to go back into the dine-in setting?
Yeah, absolutely. No, that's a very important role. Probably a lot of people don't know that the county serves in making sure that our restaurants are clean. When you see those reports in the newspaper about 2 stars, 3 stars, all that, that's the county that does that. And even though we've gone here for the past few weeks into the takeout mode, we still all want to have clean restaurants. We still want to, now more than ever, want to make sure that those kitchens are clean. So we're in there. Of course, as our inspectors have been going on, we've been respecting social distancing, all of that. But now, as next week, we'll be moving into a dine-in setting again, then we're providing those restaurants with kind of checklists that they can go over so that they make sure that they're fully prepared for those who, are going to be opening up to the public for dine-in, that they're ready for it.
Getting back a little bit on the testing side. So the, testing, we were seeing, I believe, the overall number of positives go down, or at least they've gone down for the last, if you look at the last 2 or 3 weeks, because we've ramped that up. But can we talk a little bit about the contact tracing, because that seems to be a big part of this. As we open up the economy safely, we need to know where there may be some hot spots.
Yes.
And how we could identify those who were close to those who have contracted the disease.
Absolutely, Glenn. Couldn't agree more. Contact tracing is a key piece of reopening the economy and being successful and being safe. So at Maricopa County, we just voted as a board yesterday, actually, to go and increase our capability to contact trace 8 to 10 times over what we've been doing. Now, it's important to understand we have been doing contact tracing on every case that has come in since January 26th. So we have epidemiologists, we have investigators, they're on the phone, they're spending literally, let's say if someone tests positive with COVID-19, one of our inspectors gets on the phone and does an interview that literally lasts for hours. If you can imagine, having to go through and unwind the past couple of weeks, every place you went. Again, especially, it might be a little easier right now, like, well, I was at home, yes, I was at home. But again, is to your point, as we start to head back out into the community, then we're going to have to go. So you have to go through that. Then we determine, okay, these are the people. First of all, obviously, these are your family members. So those are your close contacts. These are maybe the healthcare workers that you interacted with. And then these are some of the more casual contacts, either at work or at, wherever the case may be. Then our investigators get all that information. Then they're back on the phone. Now they're calling up your family members and giving them advice as to how to deal with symptoms, whether or not to quarantine, and then calling up that healthcare facility, finding out if they had appropriate PPE. So this is painstaking work, but it is so important. It's so important that Maricopa County has just added 60 new positions. So
6-0?
Yeah, 60. So that's going to be 10 epidemiologists. Each one of those epidemiologists will have 5 investigators under them, plus about 10 support folks. We can't get this stood up quick enough. So as a result, we entered into a contract yesterday with the Crisis Response Network and 211 to help us to stand this up quickly. And again, they have the experience where they can really help us to get this going. So we mean business with this. There's nothing more important that we're doing in Maricopa County right now than addressing public health. And as this county opens back up, this contact tracing is key.
So 60 new people coming online. So about how many people total roughly are going to be part of the full
Probably
squad?
When you put it all together, at least 200. But
wow.
But I want people to understand, because they hear things from other localities or whatever. We will staff up as much as we need to. Here's what's going to drive this is the number of positive cases we get, right? We get more positive cases, then we need more people to staff this. And again, right now in Maricopa County, we're running in the 200s somewhere, as you know, about 200, 220 new cases. As the testing increases, as the testing blitz increases, that means the number of cases is going to increase. So I don't want anyone to be alarmed if they see soon 400 new cases a day. That would not be surprising to us, given the increase in testing.
Given the increase in testing. So the trace, is this work done by phone, or is there physical interaction?
Yeah, well, again, given our current environment, it has been by phone. I anticipate that's probably how it continues, again, out of an abundance of caution. But again, I'm, if the doctors tell us that some of these things can happen in person with mask and social, that's fine. But to this point, it's been phone. Again, just from a efficiency standpoint, yeah. I think the phone is very efficient, of course.
So
Supervisor.
here you, yeah. Sorry, Garrick, please.
No, Glenn, finish your thing.
No, please. I'm out of thoughts anyway.
Supervisor, we don't typically think about elections and public health, but you are now, because the Board of Supervisors is playing a more robust role in the elections process. And that's something that's new to the Board of Supervisors. So can you talk about the new role that you've taken on and how we're going to conduct this year's elections in a safe way?
Yeah, absolutely. So I think, as a lot of your viewers know, we've had some challenges with the elections in the last couple of cycles in Maricopa County. Just a lot more attention on elections. So last year, we voted as a board to step up and resume our statutory responsibility. I mean, since the 1950s, the boards of supervisors have actually been responsible for election day operations. But the way that it's worked in Maricopa County is that the Board of Supervisors turned that authority over to the recorder. As you know, the recorder has the early voting responsibilities. So as a result, for decades, that has all resided with the recorder. But given the importance of these elections and given all the eyeballs that are frankly on it, we thought it would be best to stand up alongside the recorder. So the recorder continues to be responsible for voter registration and early voting, and now the Board of Supervisors is responsible for election day voting. And to your point, that puts a great emphasis on these election, well, given COVID-19, puts an added emphasis on the election day operations being, in person. In the Democratic PPE that we had, our election day head of election day operations, Scott Jarrett, and his team put a ton of work into it as far as having the cleaning supplies necessary and limiting the number of voting locations. And we had a very successful election for the Democratic PPE. Now we've got an August election and a November election, and we've got to get this right. We had a meeting of the Board of Supervisors actually earlier this week where Scott Jarrett came and presented to us a proposed plan for the August election, and it is changed given COVID-19. So what he has proposed, and we didn't vote on it yet, we'll vote on it in June. What he proposed was moving to a vote center approach. So again, historically, we've all voted, at our own precincts and had some hybrid with some vote centers. Given the reduction in, well, first of all, reduction of folks that are going to be willing to host us, it's going to be harder to get locations, be it, schools, churches, whatever. And then also, frankly, we're looking at fewer election workers, poll workers, most likely. So given those two things, his proposal is to go down to about 75 to 100 vote centers. Now, at these vote centers, we would have at least nine separate check-ins with the site books. So it's a small number, but with all those site books, you can get a lot of people in and out. Heavy emphasis on cleaning supplies, cleaning, high-touch surfaces, and providing appropriate social distancing. So we're working on all this, and like I said, it will come back to the board for a final vote in June, but it's something that we're watching very, very closely because the right to vote is so important. I don't know if I saw this week, Poland just postponed their presidential election given COVID-19. We don't want to do that. We would really like to avoid that if all possible, but we want this to be safe and we want everyone to have the right to vote on election day. Having said that, we remind people that we do have ballot by mail in this county, and people have the right to sign up to receive one of those ballots in the mail. So we would encourage people who aren't signed up for that already to go onto our website and avail themselves of that opportunity.
I broke down and did that a couple cycles ago, so it actually is something I prefer doing. It gives me more time to read the ballot and ask friends on a whole bunch of races that maybe I don't have the level of expertise that I need to make a good decision. Before we go though, you've got a great background also in business and manufacturing. And we're now at that phase where we've got to be thinking about how we rebuild this economy. Over 500,000 Arizonans out of work, over 33 million Americans. What do we need to do? We entered this pandemic as the strongest economy in the country. We want to exit it that way. What would you recommend, Supervisor?
Well, the first thing is we need to do the things that we've been talking about on this interview. We've got to get people feeling safe to get out again. And so that's where the testing and the contact tracing is very important. Now, once we do that, we can't forget what got us to where we are. And that is having a pro-business environment, an environment in Maricopa County and across Arizona that encourages entrepreneurs to go for it, right? And take risks. We're going to need that now more than ever. And when we do those things and we continue to focus, we let the local governments focus on those things that they're good at, as far as, providing police services, fire, parks, and then having a direction at the state level from a policy perspective that is something that businesses can count on consistently, no matter what county they're in or what city they're in. That is a winning combination. And I think if we can remember that focus, we're going to be in good shape, because I believe once this economy gets going, we're going to have the flow of people to Arizona, in particular to Maricopa County, is going to continue, because people love coming to a place where they can go for it, right? And there's an entrepreneurial spirit, and there's a government and a chamber of commerce that supports them and doesn't fight them. So we can't forget what got us here in the first place.
Beautifully said. Garrick?
Well said. Supervisor, we're just so fortunate that you're not only serving on the board, but you're bringing to that board some real insight, as Glenn said, not only in the business world, but specifically in the manufacturing sector. Thanks for joining us for this Friday night edition. Glenn, I can't think of a better way to end the week than to talk shop with Bill Gates.
Well, thanks for having me, and really appreciate you guys doing this. This is important information you're getting out to people all across the county.
And Supervisor, we learned a lot across the board, but particularly on the contact tracing, and that's just great news. One thing I didn't ask that I'm sorry to, as a sort of a postscript on this, are those funds that are coming through the federal government, is this part of the new federal testing dollars that are allowing these contact tracers to be hired?
Yes, we're getting the federal support that we need on this, and we're grateful to our congressional delegation for their support on it. Definitely.
Excellent. Thank you.
Thanks so much.
When we get on the other side of this, let's make sure that we catch up with you soon. All right.
Sounds good. Look forward to it.